Professor Salma Abdalla, who's a professor in global health epidemiology, School of Public Health. Salma.
Thank you. Well, good afternoon, everyone. And as Andrew and Jonathan mentioned, I am an assistant professor. Still feels weird because it's very new, so I'll try to practice that as much as possible, but I just started as an assistant professor at the School of Public Health. But today I wanted to make an argument of why we need to use a population health science approach to addressing gun violence in the US. And to those who are not familiar with the term, those of us who work in population health science really focus on the context that we have health conditions in and health issues in. So we look into the social, economic, and policy context. We also look into the consequences and the distribution of those consequences within a population, whether that distribution is one end or another, and how can we address those issues. But we also look into what type of population level interventions that we need to address those issues at a higher level rather than the individual level interventions. So why do I think we need a population health science approach to this issue? Simply put, because we have more guns in this country than we have people. So because of its ubiquity, I just think it is very clear that gun violence and the consequences of it should be a public health problem and should be looked at from a population health science perspective. Now, as you can see here from those two maps, this looks into, on the left, we see that there's a map of the United States that highlights state gun laws, strength. This is the context I was speaking about. And on the right side, we see a map of the states and 2020 gun death rates. And it's very clear here, it's a correlation, but it just creates a clear message that the context, the policies that we have lead to health and to gun death. So what the strength of the state policy leads to the number of gun deaths that we have in that particular state. Now, even though we don't do empirical work on that specific area and that context in our lab, what we try to do in our writing, particularly in collaboration with Dingalea, is to highlight that whenever we talk about gun violence in the country, we need to speak about that specific context. What does it mean to speak about gun violence and gun laws in California compared to speaking about it in Florida? Now, when it comes to our own empirical work, I am mostly interested in population mental health. And when it comes to gun violence, we're particularly interested in gun violence as a mass traumatic event, particularly mass shootings. So what we try to do is work, being funded by the Department of Justice, work in trying to understand what is the community prevalence of mental health issues following a mass shooting. So not just people who were affected by the mass shootings, but the community of people who live in that area. So we were funded by the Department of Justice, and we conducted surveys in 7 areas. 6 of them, the ones highlighted in blue, are community-based surveys. We try to understand the prevalence within the community. And the one highlighted in red is Las Vegas, which was direct survivors surveys, and we work with the FBI to try to identify those people. Now, we're still working on this data set, and Dr. Abaje will help clarify some of the results we had from this data set. But overall, what we're interested in is trying to understand the prevalence of mental health issues following a mass shootings in those areas. What is your level of exposure? Were you directly affected? Were you part of the community? How does that shape your mental health consequences? What does the media coverage of the mass shooting, how does that intersect with the prevalence of mental health issues in the area? But we're also interested in the mental health unmet needs in the area following a mass shooting. What can the government and other entities do if a mass shooting happens? And as well as interested in the ripple effect. So after a mass shootings, were there people motivated to actually buy a gun because they thought that would protect them more or not? So we're interested also in those unintended consequences. So that was context, consequences, and we're also interested in what type of population level interventions that can lead to helpful practices that can reduce the consequences of mass shootings, mental health consequences of mass shootings following mass shootings. So to do that, and as Dingalea mentioned and as Jonathan mentioned, we don't really have a lot of literature. So what we try to do is use some of the literature we find out there, and we built a synthetic population using an agent-based modeling approach to try to understand what type of community level intervention that we could have that would reduce the prevalence of mental health issues in a community following an accident. So we simulated the Parkland population, we created that synthetic population, and we ran 2 simulations. The first one, you can see here on the x-axis is the time that we ran the simulation for. So we tried to run the simulation for 2 years, and on the y-axis we have the prevalence. We ran for the first simulation something called usual care. That is usually means psychological first aid, something that the government usually provides for people who are direct survivor of an issue. On the other hand, we run a simulation of something called step care, where we provide community-based and community-level mental health support based on the need of people and what they say they would like to have, instead of just saying, if you're not a direct survivor, you do not qualify for this. And as you can see here, looking at the step care in the blue bars, the prevalence of PTSD and post-traumatic stress disorder went down very quickly by 2 years if we apply the step care approach compared to usual care approach. And now this is a simulation, so our hope right now is that since we collected data from the Parkland shooting, we're going to feed it to the model to actually refine our predictions. We also created a cost effectiveness model to try to provide those interventions to the government and argue for more step care interventions following mass shootings. I think I'll stop here. If you have any questions or if you're interested in collaboration, please reach out. Thank you.